One of the aspects we try and teach our young oncologists here is to always give hope. And in fact, that's our sunflower image. It's about hope. Do you find that some doctors may take away some of that hope? Or the way they communicate? You're laughing.
Yes, I can say most definitely, and I won't name chapter and verse, but many years ago I had a fairly serious illness, myasthenia gravis. All the medical people will be aware of it. Quite debilitating, and this is about 30 years ago now. And I started to make a recovery using naturopathy and homeopathy. And I went back to the specialist, highly regarded in Adelaide, and he said, "Oh, I wouldn't put too much store on this. It's in remission, it'll come back." And as I walked out of his office, all the symptoms literally came back. And it took months of my own reinforcement and things that I did for me to get back to full health. And as you can see today, I don't really show a lot of signs of myasthenia gravis, which left me with droopy eyelids and no muscle strength at all. So I think doctors, meaning well, really have got to be very careful and have a case to answer if they don't give their patients hope. Because if you don't have hope, none of the treatments in the world are going to do anything for you. You must have that belief that you're going to get better because it starts within.
Craig, do you have a comment?
Well, I think, patients sometimes relate stories about they were told, there's nothing more we can do for you. I think that's probably the most devastating thing anyone can ever be told. And it's tricky when we're stopping treatment. I think it's quite difficult that process. But in my own practice, I know my colleagues, what we try and do is say, well, look, we're stopping this treatment, but there's lots of other things we can do to try and help you. And it may not include more surgery or more radiotherapy, more chemotherapy, but there's always things that we can do to make you feel better. But, I think that's quite an old-fashioned line. Hopefully that's disappearing from medical practice, this sort of statement about there's nothing more that we can do or I can do for you.
Can I just add something to the original question, John? I think that the adjustment process that accompanies a cancer diagnosis is a real process and necessarily has to be gone through with a period of depressed mood and hopelessness and so on, which the literature tells us about 75 to 80% of people resolve on their own given sufficient information and support. But I think it's also important to say that the community incidence of depressive illness, is conservatively about 5%, so about 1 in 20 people at any one time have a depressive illness. So it's really important as well to have a look at that, and if it's not resolving with all of the information and support and other complementary and alternative strategies and homeopathy and whatever else it is you're using, if your mood's not improving, then you really need to seek expert help about that. And the advantage of living in 2006 is that we have good pharmacological remedies as well as the supportive measures. So don't lose sight of the fact that you may, as well as your cancer, have a depressive illness.
Thanks, Kim. Back to James.
Next question comes from Ballarat in Victoria. Sleeplessness seems to be a major factor in fatigue. Is there any reliable approach that can be used to manage this problem?
I might start with Robert first.
Okay, John, yes. As I showed, several studies have demonstrated considerable improvement in insomnia with physical exercise. As we all know, if you are active, it does make you tired and you do sleep better at night. And that would be my first piece of advice, is that the physical activity will improve your quality and quantity of sleep.
Craig?
Can I just add a few things too? There are a lot of simple approaches to improving sleep and to understand how to sleep well. I mean, obviously, if there are symptoms related to pain or the condition, then obviously they need to be addressed because it'll be hard to sleep in the absence of that. But once they're dealt with, there are a lot of things that we can do to learn to sleep better. And sleep is actually very important for cancer. And there are a number of studies that sort of suggest that better outcomes with improving quality of sleep a distinct possibility, both in terms of managing symptoms and perhaps an outcome as well. But learning to regulate our body clock and to know to register when there's time to sleep, to look at whether we're disturbing sleep cycles with sleeping too much during the day that can sometimes make it difficult to sleep at night, to learn how to, to relax deeply, which is not easy. It takes practice. The more you practice it, the easier it gets. Physical exercise. So there are a lot of things, and somebody should perhaps speak to somebody who's trained in this area to improve quality of sleep. So useful and important.
Okay.
Next question probably sort of backs onto this a little bit. That what is the role of exercise when dealing with extreme fatigue? This is from someone in Brisbane.
Robert?
Look, I'm not saying it's easy. It's hard for me to get up in the morning and do my physical exercise also. But of course, when you're feeling the fatigue, which is quite overwhelming, it becomes even more so. There's some very good fatigue management programs which are available throughout the country and are available through various centres, but also information on the websites, cancer-related websites. Exercise, it doesn't have to be a large amount. We see that most people are doing zero. 57% of the Australian population are sedentary. And so it doesn't require too much of an increase in physical activity to see the improvements. And what we're suggesting now is to take it in very small steps and to gradually increase. And it's taking that first step. It applies to so many things, but it also applies to exercise, is to get out of the armchair and just try something small. Walking to the front garden and getting the mail and walking back, that's a good start, and then build on it from there. And also we're advocating small sessions of exercise. It is good to go to a centre, a cancer care clinic or even a health club and do a half hour or an hour of exercise, but that's difficult to manage within a fatigue management program. And so what we're advocating now is to take micro sessions, which might only involve a couple of minutes or 5 minutes. But if you do 6 10-minute sessions a day, you've got your hour of exercise up and you've achieved a lot for that day. So there's ways in which you can manage it.
Thank you.
Yes, I think there is a risk of overdoing it and having a negative impact and then throwing up the hands, I can't do it. And I think that's really wise advice to start small and work up.
No, absolutely, yeah.
That's very good advice. James?
Next question is from Geelong in Victoria. Children with parents enduring treatment, is it important to involve them, or should we empower children or protect them?
Kim or Kate?
We should definitely empower them. Let's take the opportunity of making the cancer experience a positive learning experience. You can't change the fact that you have the cancer, but you can improve the way that it makes your family relate. So, yes, it's really important to involve kids. They can take on small bits of responsibility that will make them feel better about themselves. That may present problems down the track when you want to go back to normal and they're a bit more independent and autonomous than they used to be, but it's a good way to get through the treatment. And I think we're absolutely empowering them rather than keeping them in the dark. And don't pretend that if you decide to protect them by not telling them, that they won't hear it somewhere else. They'll overhear a phone conversation, they'll hear their schoolmates in the schoolyard, and they'll get wrong information, and they won't then know where to take it to get the right information because you haven't empowered them to have correct information.
Louise, you've got a comment?
Yes, and because of the impact of a disease like cancer on the whole family, children in those families are considered, in terms of carer associations, as being young carers. And there are programs through both carer associations and cancer councils in various states that support children who either have siblings with serious health problems or parents. So it's worth remembering that.
It's interesting, someone who sees lots of breast cancer couples, the number of times I say, have you told the children? And they've said, not yet. And usually they burst into tears at this point. It's something they've struggled with, but it's something that a lot of doctors forget to ask, and we need to give some guidance as well. James.
There are lots of resources out there for kids. The New South Wales Cancer Council booklet on dealing with children when a parent has cancer is particularly good. I presume the other cancer councils have something similar, and the websites I referred to are a really good starting point if you're having trouble with this.
They're good resources. James.
Next question's from Broome in Western Australia. Following surgery and radiotherapy, I have experienced many treatment effects. What help can I get to help me manage them, especially down the track?
That's a very broad question, but I guess there's the early effects, the mid-range effects and late effects, which depends on which part we treat, but probably the a lot of the issues that have been spoken about today, tiredness, going through menopause, weight gain, dealing with the emotional, very important. But I'm not sure if any of our panel have got any specific comments there.
I guess the first thing to do would be to go back to the oncologist that's been treating you, and whether that, if you're in Broome, I don't know whether you still go for follow-up in Perth, or whether there's a visiting clinic in Broome, or whether you contact by phone. But I would say that would be the first place to go to, and otherwise the Cancer Council helpline would be another starting point for some assistance.
I think,
Craig? Sorry.
Yes, and just
And
to...
your GP.
Well, certainly a general practitioner can help, and many of the lifestyle self-care things we were talking about before can help us to be in as good condition as we can to move through the treatment. And also, I think that's where a lot of people are using constructively some of those complementary approaches, which can help with symptom management as well. So we're doing what we can medically, and also looking at some other strategies which, and clearly there's increasing research that many of them can help with ameliorating some of the symptoms that people are experiencing.
Kate, you got a comment?
Yeah, I was just going to add, I mean, I think there are specific symptoms that will require specific attention. So it's really important if you've got a particular problem that you go firstly to your general practitioner, and then they can make an appropriate referral. I do know there's someone really good at doing follow-up for radiotherapy currently working in Broome, so ask around, you'll find her. The other thing I'd say is if you have access to the web, there's some really good sites, and they often use the terminology survivorship, which are very much geared to cancer survivors, very practical about little step-by-step strategies that you can do. I know there's several for breast cancer, and there's also a more generic one, survivorship one. Most of them are American, but the information and the context is certainly very applicable in this setting, and they just give you very simple little strategies. And I think, as both Kim and I have mentioned previously, think about the things that you've done in the past to help you either physically recover from something, and often they're the old remedies that your mum might have gave you when you were feeling nauseated. They do actually work. When you're a child, perhaps, or what are the things that helped you get through a particular situation in a previous time?
Thanks, Kate. I think you also mentioned in your talk that not every single pain that we get is cancer, and I know that's the biggest fear, the pain in the back's cancer, and they come running to see me. But you say, what have you done last week? Well, I just cleared the whole back garden. James.
Our next question comes from Darwin. Please elaborate on the notion of sombre spirit expressed by Indigenous people, and how neglect, manifested as ill health, can be addressed and included as part of the holistic care.
Does anybody want to take? So the essence of the question, I think, was the sombre spirit.
Sombre spirit of the Indigenous population, and how that that can be encompassed in part of the holistic care of a patient. Any comments on that from Craig, perhaps?
It's interesting the way we view sometimes feeling sombre or feeling depressed or challenged or anxious, that we tend to look on it as a negative thing or a bad thing. Now, I'm not going to be able to comment in any way as an expert on Indigenous health and how they would view something like cancer. But perhaps just looking at these things as opportunity, that very often the unhappiness or the sadness or anxiety that we feel can very often be the very thing that, although uncomfortable, is a pointer to what in us needs attention and needs help. Like a physical pain in the body, as unpleasant as it is, it's telling us something about something that needs attention and help. I'm not sure if that sombre spirit in the Indigenous sense is a part of that moving through an adjustment, a natural sadness, a point of transition, but that may be used to perhaps some sort of good effect. But I think paying attention to our discomforts, both emotional and physical, not preoccupation with them, but paying attention to them, we can often learn something valuable from them, and thereby, I think, be improved through the experience.
Thank you. James.
Next question is from Newcastle. How do you suggest lay people make a decision about treatment options when it's hard to access second opinions in rural areas?
Okay, so it's a question on accessing second opinions and being a layperson. I guess maybe you could start off.
I live in Adelaide, so it wasn't that difficult to get second opinions. And when I was talking earlier, I thought exactly that. How do people in rural areas gain that second or third opinion? And if you're getting an opinion from someone who you know, and you say, look, I'm not happy with that, that creates a whole issue again. When I went to see my specialist, I didn't know them, so it was fairly impersonal. So when I said, look, I'd like another opinion, it wasn't sort of like any sort of insult. Yes, in rural areas, other people would be better equipped to answer that than me.
The other, Craig? What do you think?
It's a very difficult issue because, it is a real issue in regional areas and people don't have the same degree of choice, and it often means you need to travel for second opinion. But I think most regional cancer specialists recognise that this comes up from time to time, and I think 90% of the cases a second opinion really validates the first one. So I think it's just a matter of asking either the specialist looking after you, if you've seen a specialist, or your general practitioner to organise a second opinion. It often need to be in a different centre, but that's unfortunately one of the things that regional people have to deal with.